Minister, I want to firstly acknowledge 1,615 people have passed away. Even though this has been a very significant week, we can never forget that and never forget their families today. But I also acknowledge the massive work done all over the country. But I want to focus today on my own county of Mayo. The work done by health workers, by carers, by home health, family carers, professionals across the county has been immense under hugely challenging circumstances. There are a number of specific difficulties that I've spoken to you about, and I'd just like your views in relation to the difficulties at Mayo University Hospital in particular, where staff have been in contact with me and a number of public representatives in relation to what they see as the continuing, up to last week, crossover of staff between COVID and non-COVID units, that staff are moving between units, are traversing through each unit to get to another unit. Secondly, the inadequate physical space that's within the hospital between a COVID unit and a non-COVID unit, which may make that crossover inevitable for some. Thirdly, the lack of an isolation unit at Mayo University Hospital and also at the district hospitals in Ballina, in Belmullet and in Swinford. And are there plans, as we catch our breath from what may only be the first wave, to invest in capital facilities and hospitals across Mayo, but also across the country, looking at the lessons learned in the last number of months and putting investment in place to ensure that these hospitals are ready for what may be an ongoing COVID situation? I also need to know what are the testing levels of staff at Mayo University Hospital and at all the district hospitals and all the health facilities across Mayo. I know there was a great effort put in a number of weeks ago. Has that continued? Has that been updated? And what percentage of staff at Mayo University Hospital were actually tested? And finally, Ministers, there is the issue of derogation, where HSE Occupational Health may advise somebody who is defined as a close contact not to work, but their line manager, and this applies all over the country, but their line manager can ask them or derogate them to work. What are the rules around that particular policy?
Thank you, Deputy Minister.
I want to thank Deputy Calleary for raising the issue and join with him in acknowledging the passing of many of our citizens from COVID-19. And you know, I often feel somewhat uneasy. We're talking about progress and statistics and figures, but we're not talking about them in a vacuum, because this is a virus that's caused a lot of tragedy to an awful lot of people, and we think of them. I want to thank Deputy Calleary for raising matters in relation to Mayo Hospital. I know he's been directly in contact with me in relation to these issues. I am advised by the Céilta Hospital Group that appropriate control measures are currently in place in Mayo University Hospital in relation to COVID-19. As is the case across hospitals, Mayo University Hospital have adjusted how care is delivered to patients, as well as continuously implementing updated national advice. Actions taken include streaming patients into COVID and non-COVID pathways. This did require some physical changes to the hospital, including a new entrance. Where possible, patients are treated in single rooms. However, given that the infrastructure in the hospital is not always possible to provide single rooms for patients, which I think is the point you're making about isolation facilities, patients who attend the hospital through ED are also separated into suspect and non-suspect COVID-19 patients. Suspected COVID-19 patients who attend via the ED are tested with rapid turnaround time. While every effort is made to ensure patients are streamed separately, occasionally it will happen that a person in a designated non-COVID space will turn out to be positive, as they may not have shown any symptoms. Patients who develop symptoms consistent with COVID-19 in a ward are tested rapidly and transferred to a COVID-19 ward if diagnosed positive. The hospital has separated its clinical staff into teams to minimise contact and to reduce the risk of healthcare worker and patient infection, again all based on the national guidance provided at that time. Céilta have provided executive microbiology and infectious diseases input into the management of COVID-19 in Mayo, but in light of the serious issues that Deputy Calleary raises, I will now ask the CEO of the HSE for a report in relation to the matters you've raised with me, Deputy, and that report to include information on the testing levels of staff. My understanding is the National Public Health Emergency Team is likely to broaden the case definition in relation to testing tomorrow at its meeting, certainly something under consideration. And I'll also ask specifically in relation to the supports for the district hospitals in Ballina and Swinford and across Mayo, and for a view on the derogation. So I'll get you a written report from the CEO.